Hi. Hello. Am I live? Yes, I am. Hi. Welcome to another video class. I'm Dr. Sylvia. I'm a general practitioner and health educator with AskAwayHealth, and we are sharing health information to help you learn about your bodies, feel and be better. That's what we're all about. Okay, it is a few hours earlier than usual, today's live stream, and I apologize. I didn't even schedule it because it's been so busy, but I really wanted to be consistent and maintain my class schedule, make sure I post a video live video at least every week, as we've been doing, make sure that our library of health information video continues to grow. So that is why, regardless of the scramble that my day and week have been, I wanted to get this out to you. It's not going to be a very long one because I really wanted this to be just very punchy. These are the key signs that we want to be looking at when we talk about colon cancer. And I just wanted to share that information with you. Before I get started, I hope you're doing well. I hope you're well. And if you're coming across this video, if you manage to catch this live and you're interested in what I'm talking about, please make sure you're liking it. And of course, subscribe to the channel so that you know when I share videos like this again in the future. And if you're watching on the replay as well, please give this video a like and consider subscribing to the channel. And thank you so much for choosing to click on it. Right, so we're talking about colon cancer and specifically about what are the early signs. Now, colon cancer is one of those cancers that by the time the more defined symptoms show themselves, then it may be fairly advanced, is what I'd like to say. But before I get in too far into the video, I really wanted to share a little video clip with you from a practitioner in the US. I think he's a professor of hematology, according to his bio. And he has some thoughts about where colon cancer is going today, or, in the current time, or if you like, the last 5 years, 4-5 years, the changes that he's seeing. And I want to share the video. I hope it'll play. If it doesn't play, then I might have to read. But let me just add it on here and see if we're going to be lucky and if it's going to play. Give me 2 seconds. So he is John Marshall. I'm sure I have his bio somewhere. It's only fair to introduce him nicely. Oh, come on. I do have his bio somewhere. He is here we go. So he's John Marshall. He's a professor of medicine. He's the chief division of hematology oncology, and he's a director of clinical research in Georgetown University, Washington, D.C. So this is the gentleman that we're going to be listening to in a few moments. And he wants to point out a few things about colon cancer in young people. Okay, so let's have a listen. I hope it plays. I'm going to be checking, but let me give you the chance to listen to what Professor John Marshall is saying.
Hey everybody, John Marshall from Medscape. It's been a little bit of time, but I'm still here. I got a lot less hair. Still got the same junk all over my office, but it is good to be back. But I wanted to talk today about a really important subject, and that is young people with colon cancer. Now, the Washington Post decided to run an article on it just this past Friday, right below the Trump can be sued article. And it's quoting some people from the American Cancer Society and all sorts of people who should be authorities on what the problem is all about. I want to kind of take this and say, I don't think they're right. Let me tell you the problem. When I first started, 30 years ago, there was nobody in my clinic who was under the age of 50 with colon cancer. Yeah, there was an occasional Lynch syndrome patient, but nobody else was in there under the age of 50. Today, in 2023, more than half of my clinic is under the age of 50, and many are in their 20s, 30s, and 40s. And there's a lot of talk about, this article talks about obesity. None of these patients are obese. In fact, they're all marathon running, cardboard eating people. They're fit, they're healthy, they have no family history, and we don't know why they got it. In fact, we're looking at patients who are even hyper exercisers and understand that maybe they are getting more dysplasia than other patients are. Second is that pretty much all of them are left-sided colon cancers, rectosigmoid cancers. They're all clustered right there. They're not distributed around the bowel as we normally would see. So they're all in the same location. Third, a lot of these people have been screened already. And so, yes, we shifted it to 45. And so more and more patients are getting screened at 45, but it really makes me question our screening technologies and our techniques.
Okay, I'm just going to pause. Professor John, for yeah, I'm just going to pause in there because I think he said the key things I really wanted to talk about. So So I think he said the key thing I wanted to bring up, and which is to get people away from the mindset that colon cancer is only a thing of old age or people over 50, which is how we've traditionally thought about it. So I'm not blaming anybody, but when new information and evidence comes about, then you do need to look at your practices and your, attitudes and beliefs, and we need to be changing things. So he's made a very interesting point, which is that the cases of colon cancer that they're seeing now in the US are more, or they're seeing a lot more in younger people. They're doing so well in terms of screening over the last decade that they've managed to start catching it a lot earlier in people over 50, over 45. So that's not too bad. That's good news. So you're getting less advanced cases in that age group of people. But shock, you're now getting it in younger people. And not just that. And I think that's particularly worrying because in medical school, this is what they taught us in terms of the risks of cancer. Hi, if you're just joining, there are a couple of people who just joined in. Please say hi and welcome. Thank you so much for clicking on the link. As you can see, we're talking about early warning signs of colon cancer. And if you've got any points or comments, let me know. Just share a comment in the comment section. But the point that he's also made that I think it's also important is the point about obesity and weight, because we've traditionally associated that with colon cancer, and there's still no suggestion that we should change that. But there's also something else. Did you hear when he said that these people in their 20s and 30s are fit? He said they're fit, they're healthy. So they're not overweight. Apart from being fit and healthy, these are people that the word he used in his video is hyper exercise. So they're actually exercising more than average. And these are the people who we say should have a healthier life or life outcomes. So there's something to watch in what's going on there. And I think it needs to be amplified so that we check what is going on. So please, key messages to take away as we proceed for the next few minutes as we go into these things are: this is not a disease that is just for your moms and dads or older aunts and uncles, or when you get into your late 40s and 50s, then you can start to worry about it. And that's why I really want to hammer home these early warning signs that I've picked up, and I want you to be conscious of them. So those are the key things that I wanted to share, that this condition, colon cancer, is happening in young people, that they're seeing it in the States. They don't know why. They're trying to look at the studies. They want to come away from assuming that it's only associated with being overweight, because there may be something else that's going on. Obviously, something else that's going on in these younger people who are fit and quote unquote healthy. Okay, so even though screening has improved in the US and they're catching it much earlier in older people, now there's a problem in the younger age group. Something needs to be done. So now that we've got that little bit of information out of the way, and I sort of set the stage for why you should be interested in watching this video, what is colon cancer? Colon cancer is cancer that starts in the large bowel, the big bowel. Oh, I've got a picture here. Let me put up my picture. Hi, hello. Al Mamun, nice to meet you. Hello, thank you so much for joining and for checking out the live. Let me just bring up my videos or my images. So we're talking about colon cancer here, and I've got a nice graphic of the colon. I was just saying to you that colon cancer is cancer that starts in the large bowel. So this is what you're looking at, the large bowel. The entire intestine is split into your small, apart from your stomach, obviously, and your anus. It's split into your small and large intestine. So when we say colon cancer, we're generally referring to this part of the colon, of the intestine, the large bowel. Okay, so we can also use the term bowel cancer or colorectal cancer, okay, and that's used to refer to cancer in the bowel and the rectum. So when you hear these colon cancer, bowel cancer, colorectal cancer, this is what it refers to. Now, traditionally, for many, many years, as we were taught in medical school and as we've learned, as we practiced, some of the risks that people who go on to develop colon cancer have, and not in all cases. Remember that a risk factor is something that when it's present may increase the risk of a person developing that condition. It doesn't always mean that if it is there, they will go on to develop it for certain, but it means that if it's there and they develop it, it may be as a result of that thing. That's risk factor. So for people who are developing colon cancer above the ages of 45, 50, traditionally the risk factors that we've always known are things like excessive alcohol, smoking, eating a diet that is particularly heavy in red meat, processed meat, and low in fiber. So the unhealthy diet that we speak of today. So processed meat, very, very fatty meat, and low fiber, not having enough veg and fruit in your diet, all that could increase the risk of developing colon cancer. Being of older age, so yes, as you grow older, you're more likely to develop colon cancer. But bear in mind what we said at the beginning, what Professor Marshall was saying in his video that I shared. If you didn't catch that, please watch this video from the beginning. It's really useful to know. Oh, and by the way, I think I'll place the link for that, but I don't know if you noticed that was from Medscape. So that is a that is a link for Medscape. It was just published a month or so ago. Yeah, just about a month ago. And the title of the particular article is Colon Cancer in Young People. And he's saying it's not an obesity issue. Okay, so back to what we're talking about now. We're looking at the risk factors for colon cancer. I've just mentioned age. There is poor exercise, a poor exercise habit, family history. So if somebody in the family, a relative, a close relative, like your nuclear family, a mom, dad, sister, brother, that could increase your risk of developing it. Also, certain medical conditions, for example, inflammatory bowel diseases. So if you've heard of things like ulcerative colitis, Crohn's disease, these conditions long-term could increase the risk of people developing colon cancer. Also, having had colon cancer in the past, if you've previously had bowel cancer, then it's been treated, it may come back. Conditions like diabetes as well, where there is hyperinflammation that works in ways that we do not yet fully understand, but that could also be a risk of colon cancer. So please remember, we have not said that obesity is no longer a risk. It is still very much a risk, but we're seeing something else in young people, age 20 to 30, who are not obese, who hyper exercise, who are fit and who are healthy. So we need to do more work to work out what's going on, what's happening in that demographic, what is contributing to their colon cancer. So this is the meat of the matter. What are the signs that could suggest colon cancer? And which are the 4 that I really want you, whoever you are, to make sure that if you experience, please don't ignore. So generally, the signs that could be associated with colon cancer, you may feel a need to strain when you're going to toilet. So even after you've been, and I'm just plucking them out because I'm going to read I'm going to talk about the sort of less common ones, and then I'm going to narrow down into the ones that you should definitely pay attention to. So there may be this feeling of discomfort in your back passage, in your anus, after you've been to the toilet, especially after you've been. So you've gone and you think you should be feeling comfortable, because remember, we are stimulated to go to the toilet to do a poo by our nerves, and because of the presence of the feces in the anus and the rectum that stretches, that sends a message to the brain, then you feel, oh, I need to use the toilet, and off you go. And when you've emptied your anus or your rectum, you should feel comfortable and that sensation should go away. But when you still feel as if you need to go, even though you've gone, that sensation is something that you should probably bring to your doctor. Don't ignore it, especially if it's recurring, it's persistent, it's not going away. The next, of course, is losing weight. That one is not a surprise to anybody, because most types of cancer are associated over time with weight loss. But then by the time you're picking up weight loss, things have advanced, haven't they? So that's not an early one, okay? But weight loss is a symptom, which if you cannot explain your weight loss, you're not exercising, you're not eating more healthier than usual, you're not doing anything, but the pounds are dropping off, like the way that we wish the pounds would just drop off, but it is not normal. Don't we wish the pounds would just drop off if we wanted? No, that's not normal. So let's get back to serious. if the pounds are dropping off without you doing anything about it, please talk to your, you have to talk to your doctor about it. And then another symptom is feeling a lump, and your doctor might bring this to your attention, maybe doing an examination for something or the other, and a lump is felt in the anus, or the one that you yourself can feel is a lump in your tummy or abdomen. So you can feel, something is not right. Please don't ignore them. This cold suggests colon cancer. But we have more recent studies that suggest that there are 4 signs that could be the earliest you might pick up for colon cancer. And the reason I wanted to talk about them is because they're not very, very specific, unique symptoms that, if that happens, it's definitely colon cancer, which is a problem for diagnosis. But the fact that you're aware will help you to move to speak to your doctor quickly and, start looking at talking with them about getting tests done sooner than later. The first one is abdominal pain. It's abdominal pain, and abdominal pain is what it is. It is what it is. It is abdominal pain. And there is nothing that is exactly specific about the abdominal pain except that it could be a very early symptom that might suggest colon cancer. And I know you're sitting there saying to me, but abdominal pain could mean so many different things. I know, but you can't ignore it. That's why we're here. That's why your doctors are here, that when you come to us, we need to sit down with you and try and exclude all the other possible things, okay? So if you're getting a non-specific abdominal pain, stomach pain it's just there, it's never getting better, you're taking medicine, you're eating, it's just there, it's not getting better, and it's going on for a couple of weeks, 3-4 weeks, and you take like many people will do, they take paracetamol, no better, they take an antacid or Gaviscon, is no better, they use a water bottle, is no better. You need to be speaking to your doctor. Where the pain is located, it can vary. It might depend on where the cancer is located. You can see how the colon spreads from that picture I shared earlier. Let me just bring it back for you. You can see how the colon stretches across from one side of your abdomen to the other. So really, I can't sit down and say to you that this is where the pain is and that is specifically going to be for colon cancer. It could be anywhere in your tummy. But the point is that abdominal pain could be from so many different reasons, like irritable bowel syndrome, inflammatory bowel disease, gallstones, cysts like ovarian cysts, even stomach ulcers, having acid reflux, pancreatitis, so many things, a stomach bug. So many things can cause abdominal pain. And we may not be immediately thinking about cancer in that instance, but the point is that if you're having an unexplained abdominal pain that's not getting better, please don't ignore it. Please don't spend all your money drinking all the antacids because you're too busy thanks to work or whatever. You really need to sit down and have it looked into with a doctor so that they can make sure it's not one of those things like colon cancer. So that is the first one. We're talking about 4 early warning signs. If you're just joining, thank you so much for clicking onto this. It's a quick one that we're doing today, but I really wanted to push out things I want to be in your head about colon cancer. And I really wanted to emphasize that it's not just for people over 50, please. And that's why I shared a video at the beginning. If you've not been here from the beginning, go back and watch the replay. That video is really helpful. It's saying that younger people age 20 to 30 who are otherwise healthy are getting colon cancer. Okay, so we've talked about abdominal pain. The very next one is rectal bleeding or bleeding from the back passage. And you say, oh yeah, I knew all about that. That's fine. But I also want you to know that abdominal pain is the most common early warning sign. Next is rectal bleeding. Okay, anybody stooling blood, that should make you sit up. You need to be asking why, because that is not normal, stooling blood. So you need to be asking what's causing it. Commonly, it could happen for many different reasons. Now, if you stool bright red blood, yes, it could be a sign of colon cancer. It could be, it's possible. It could also be piles or hemorrhoids, as some people might know. Or it might be anal fissure. A fissure is when there's a tear in the tissue of the area around the anus, the skin around the anus, and cause it to bleed. So there are different things that might explain bleeding from your anus, or rectal bleeding, or from your back passage. Why am I saying this? You need to speak to your doctor. There is no way we can tell where it's coming from without examining you. And linked to that is, I've just said it's bright red blood, but if there is a cancer that's a bit higher up in your in your abdomen. Let's bring that picture back again. Here we go. So if there's a cancer that's sort of lower down, like this orange one that you can see on the screen, that might cause you to have bright red blood when the cancer invades tissues around. But if it's one that's right at the very top, right at the top of the abdomen, by the time the blood works its way down into the rest of the bowel and then comes to your anus, it may have changed color. So it's not bright red anymore. It might be looking darker, black, very dark brown, and so on. That will also concern me, because I'd be asking myself as your doctor, where is this bleeding coming from? And we need to do tests to work out where the bleeding is coming from. So please, even though that black stool or black appearance of the stool may be less common in terms of colon cancer, it should be addressed. It should never be ignored. So that's the early sign number 2. Early sign number 3 is diarrhea, or a change in the bowel habits. Thankfully, I'm sure you're happy I do not have a picture of diarrhea. I'm sure you're very, very happy. If I could have, I would have got one, but I don't. Anyway, so we've got this one just showing the outline of the entire gastrointestinal tract, which is, in a woman, for example. So right from the mouth, the food pipe, then the going into the stomach, you can see the liver in front there, and then the bowel, the small bowel, and then the big bowel. So we're talking about diarrhea, and diarrhea is loose stools happening frequently. Now, you can get away with diarrhea for a few days if you've eaten something bad, you've traveled and you've eaten something that's not very good. But diarrhea that is going on for several days, despite you've not been anywhere, you've not traveled, you've not eaten anything that's bad, you've not eaten anything that's gone off, then it may be as a result of cancer. But don't get me wrong, there's so many things that can cause diarrhea. I mentioned inflammatory bowel disease earlier, like Crohn's disease or ulcerative colitis, medication side effects. So many things can cause diarrhea. This is why, again, if you're experiencing it as a change to your normal bowel habits, because some people do pass loose stool normally for them. But if you're experiencing someone who normally you would pass formed stool maybe once a day or twice a day, but you start passing loose stools and it's happening more frequently, or you notice a change in the way your stool looks. Also, for some people, it may be constipation, the opposite. Some people may experience a change in their bowel motion, that is constipation. That may suggest colon cancer. So you could have changes in either way, but the one that seems to be more commonly associated with colon cancer is suddenly developing loose stools when you used to pass normal looking stools. So we need to be suspicious when that happens, even if there is no blood in it, even if it's looking normal color, even if it's not looking black or anything like that, we still need to be concerned about it. Okay, so we're talking about early warning signs for colon cancer, and we're on to the 4th one, which I wanted to talk to us about today. And that 4th one is anemia, specifically iron deficiency anemia. So anemia is very, very simply is when your blood levels are low. And generally, there are different types of anemia, different things that can cause anemia. But particularly in this instance, we're looking at iron deficiency anemia. So your iron levels are low, which means that you don't have enough iron to produce hemoglobin, which causes the red color in the red blood cell. But hemoglobin is much more important than just causing the color. It's important because that is how oxygen is carried around our bodies. So that's how people who have low iron levels end up with anemia, because they don't have enough oxygen going around. Then the heart is under strain. They're very, very tired. Those are the symptoms that you will get: tiredness, problem breathing, feeling short of breath. If you're having any of those symptoms, don't think, oh, I've had a lot going on at work, or oh, it's XYZ, or oh, if you're having such symptoms developing, I beg your pardon, if you're having such symptoms developing when you haven't done excessive amount of work that could explain. For example, if you've just worked out in the gym for 3 hours, or you've just run a huge race, or you've been very, very busy, yeah, of course I would understand you being tired, but then that will pass. It's daily tiredness that's unexplained. You haven't done much, but you're feeling tired. Normally, when you walk to the kitchen, you don't think about it, but you're taking those steps now, or going up the stairs, and you're feeling short of breath. Please pay attention. Come and speak to your doctor so we can check, is this anemia? Is it related to something for example, colon cancer. Anemia can be caused by many different things. So please, I'm not saying that every time there's iron deficiency anemia, it means colon cancer, but I'm saying it is an early warning sign that may indicate, so that the reason why early signs are important is because at that stage you can still do something, that can help to prolong life as much as possible compared to if it was advanced. So women can experience iron deficiency anemia because we lose blood when we are menstruating. Okay, so outside of menstruation, or in men who do not menstruate, of course, then you have to investigate what is causing this person to have iron deficiency anemia. So these 4 signs, they could appear just by themselves in a person. So just one of them might happen, or a person might have 2 or 3 of them. The more of this sign that a person has, the more likely that it could be colon cancer. Okay, so if at all a person is experiencing these symptoms or any of these signs I've talked about, abdominal pain was the first one, rectal bleeding was the second one, diarrhea was the third, iron deficiency anemia is the fourth. Having more than one of these symptoms happening at the same time increases the chance that it is colon cancer. Okay, so those are the important signs. Before I let you go, I wanted to remind you that there are situations where if you ignore these signs, okay, if you're one of these people who is not too bothered, or you decide to look for alternative therapy, or you decide to pray about it, and I'm being very specific, and I apologize if it sounds offensive. It's not meant to offend. It's simply because I care enough to say, please have this checked out. Okay, if you see something abnormal, do speak to your practitioner and get all the options that you have. Be clear about all the options you have. And if it's your religion or your belief that leads you in a particular direction, I also have my belief, and I do not see how going to seek a doctor's advice or having tests, I don't see how our creator cannot use that process to heal. So again, respectfully, but just wanting to point out that please make use of some of the advances in technology we have today to investigate and treat some of these conditions. Some people think that it's wrong to go and seek that kind of help, and I'm here to say, please think again. Okay, don't go and spend time doing things that are not providing you treatment, or taking concoctions that are not treating you while the cancer is spreading. But if that happens, if it has advanced very fast, some of the symptoms could happen because the cancer will grow and block the colon. Yeah, so focus on that orange bit. If it's growing and growing, it can block the bowel, and so if it does that, it could lead to more pain, cramps in the abdomen, could lead to you feeling bloated. It might lead to you feeling constipated, so that you can't actually, you can't use the toilet, you cannot move your bowels, you get constipated, and then you feel bloated, and you might feel like vomiting. You feel like vomiting because there's a blockage in your tummy. Okay, this is a medical emergency. Okay, so pains like that, feeling bloated, you're constipated, you can't even pass gas, you can't even fart. So it's not just that you can't pass stool, you can't pass gas. And if you're feeling sick or you're being sick, that might suggest to us that you have a blockage in your tummy because of the cancer. And that's the medical emergency. Right, guys, this is what I have time for today. Oh, wow. Hi, Angelica. Thank you so much. And you're absolutely welcome. I hope it's been helpful to you. I promised it was going to be a short one. It's even longer than what I thought. I really thought I was going to be done here in 15 minutes. But yeah, guys, these are the things I want you to remember, please. Early warning signs for colon cancer. Watch the video all over again if you want to get the points I made at the beginning, but please speak to your medical practitioner, speak to your doctor if you have any concerns or think you have symptoms that might suggest colon cancer. Don't ignore them. Thank you so very much for watching. Thank you so much for joining me, everyone that joined in, and for those that sent in a comment. I really appreciate you. I hope you guys have a great weekend. I have a busy one, but I think I've got a bit of rest from Saturday evening and Sunday evening, so time to recover. But I hope you have a lovely weekend, and I will see you again soon. Now, we published a video yesterday on fibroids. I'm challenging some of the myths around fibroids. So if that's your thing, go and watch that video. Just came out yesterday. And I've got a couple of more videos coming out in the next few days as well. And of course, usual live streams back again on Friday. So thank you so much for being here with me. I appreciate you, and I hope you enjoy your weekend. Bye bye.